Let us now go to general adult tests. The topic is checking your heart rate. Your heart rate, also known as your pulse rate, is the number of times your heart beats per minute. The rate varies from person to person and also according to a wide range of other factors, such as level of activity, stress, emotion, age, and substances such as caffeine. Although there are considerable variations in heart rate, in general, a lower heart rate at rest implies more efficient heart function and better cardiovascular fitness, with an associated reduced risk of a heart attack. Your doctor may measure your heart rate at the same time as measuring your blood pressure with an automatic blood pressure monitor. Your heart rate varies according to how much physical activity you have been doing. To get the most accurate reading, it should be measured after you have been at rest for at least 5 minutes. This is known as your resting heart rate. To improve the accuracy of the measurements, it is important that the readings are taken before you've taken any stimulants, such as caffeine or medication. You should also try to ensure that the readings are taken at the same time of day. You can also measure it yourself using a personal heart rate monitor or many types of wrist fitness tracker monitors or smart watches, or simply by counting your pulse rate. You can get a more accurate picture if you average several readings. Although it can be normal for you to have a pulse rate outside the typical range for healthy adults, it is important to call your doctor if you feel dizzy, weak, or lightheaded to decide if you should be seen more urgently, or if you have chest pains, seek immediate medical help. Your heart usually beats in a regular rhythm. An irregular pulse can be caused by a medical problem, anxiety, or be the result of having too much caffeine. If you have an irregular pulse and it persists, you should see a doctor. A resting heart rate of 40 to 60 beats per minute may be normal for you and is typical of very fit adults. A resting heart rate of 60 to 100 beats per minute is considered to be typical for mostly average healthy adults. And a resting heart rate over 100 beats per minute may be normal for you or may indicate a health problem such as a heart, circulation, or thyroid gland problem. See your doctor who may recommend further tests or treatment. A resting heart rate below 40 beats per minute may be normal, or it may indicate a heart or circulation problem. You should call your doctor if your heart rate is less than 40. Some self-help measures are eating a healthy, low-salt, low-caffeine, low-sugar, and high-fiber diet. You should quit smoking, exercise regularly, and reduce stress levels. Your neck pulse can be checked by placing 2 fingers on your neck to the side of your windpipe below your jaw. Press gently and count for 1 minute. Thank you so much for your attention.
Let's now go to interviewing. Let's discuss choice of food eating habits. Diet influences our health in 2 main ways. First, through our choice of foods, and second, through our eating habits. First, choice of foods. Our choice of foods can become unbalanced in 4 main ways: eating too much cold food, eating too much hot food, eating too much greasy food, and not eating enough. Eating too much cold food. Cold food includes raw fruit, raw vegetables, and cold drinks. Patients are often surprised to be told that an excessive consumption of such foods might be detrimental, as this advice runs counter to the prevailing view of healthy eating. That is, eating lots of fruit and salads in order to secure the maximum intake of vitamins and minerals. It is true that raw foods are rich in vitamins and minerals, and a small consumption of such foods is not detrimental and indeed healthy. It becomes detrimental from the point of view of Chinese medicine. A mainstay of someone's diet is exclusively raw and vegetables, raw fruit and vegetables. Excessive consumption of cold foods, including cold drinks, injures the spleen and leads to internal cold in the body. This will cause a pale complexion, loose stools, tiredness, feeling cold, and abdominal pain. Eating too much hot food. Hot foods include red meat, especially lamb, beef, and game, spices, and alcohol. Excessive consumption of hot foods causes heat in the internal organs and will manifest with a red complexion, a feeling of heat, thirst, insomnia, mental restlessness, and a red tongue. Eating too much greasy food. Greasy foods include all dairy foods, bananas, and peanuts. In addition, this category includes foods cooked in animal fats and fried or deep fried foods. Sugar is also a greasy food. Greasy foods lead to the formation of dampness and or phlegm, and an excessive consumption of such foods is extremely common in Western countries, especially in the United States and Northern European countries. Not eating enough. In affluent countries, not eating enough is due to following a restrictive diet, often aimed at slimming, and also may result from following a vegetarian diet injudiciously, especially in women. Many young girls become vegetarian and not having a good knowledge of combining food. They tend to eat a lot of salads and cheese, which injures the spleen and lead to dampness. Such girls will tend to be pale and suffer from tiredness, digestive problems, loose stools, and menstrual problems. The tongue will be pale and the pulse choppy. Second, eating habits. Chinese medicine places the stress not only on the range of foods eaten, but also, and as important, on the way that we eat. We may eat a very balanced diet with exclusively organic foods, but if our eating habits are chaotic, this will lead to disease. Chinese medicine stresses the importance of routine and regularity in one's diet. It also stresses the importance of having a short break after eating at lunchtime. Unfortunately, most people who work full-time have very irregular eating habits, which may include any of the following: eating in a hurry, eating standing up, eating at one's desk while working, or having business lunches, eating without routine, large business lunch one day followed by skipping lunch the next, and eating late in the evening. Such eating habits injures stomach qi initially and then stomach yin. One of the clearest signs of this, apart from digestive problems, is a tongue with a stomach crack or scattered stomach cracks and without coating. Thank you for your attention. Let's go to Foot Yang Ming Stomach Meridian. Let's discuss Stomach 8 Head Tide. Foot Yang Ming Stomach Meridian. You can locate Stomach 8 half Sun within the ideal hairline at the corner of the forehead, 4.5 Sun lateral to the midline. Stomach 8, head tide, head support, head corner, skull safeguard. Yang Wei Mai and stomach meridians. A good point to select for the mind and spirit when the person is stuck in over-processing, agitation, confusion, and consequent despair. The crossing with the gallbladder, with its powers of new beginnings, dealing only with what is pure, and its ability to forge a path through obstruction, all reinforced by the gathering yang qualities of Yang Wei Mai, helps clear yang ascend to the head and break through the mental stodginess of the stomach when it is exhausted itself by overthinking. The local point for headaches of dizziness, muzziness, heavy head from damp and phlegm retained in the head, preventing clear yang rising upwards to brighten the orifices. For headaches arising from digestive disorders or wind invasion, headaches with blurred vision from the deficient qi and blood, it can also be used to treat eye problems, excessive lacrimation from wind invasion, eyelid tick. The indications are mental stuckness, headaches, and eye problems. The location. You can locate at the temporal corner of the forehead, on the border of the temporalis, muscle, and 5 kun within the anterior hairline, or 4.5 kun lateral to the anterior midline, due 24. To find the anterior hairline, as you can see in the figure, then locate stomach 8 at the temporal corner of the forehead, 0.5 kun within the hairline. Chewing movements of the temporaris muscle will still be palpable here. Also located 0.5 kun superior to the anterior hairline are due 24, bladder 3, bladder 4, gallbladder 15, and gallbladder 13. Anterior midline or superior to the inner canthus of the eye, or 1.5 kun lateral to the anterior midline, or 3 kun lateral to the anterior midline. These distances refer to the distance between due 24 and stomach 8, or 4.5 kun. Stomach 8 and gallbladder 7, a depression on the level of the apex of the ear within the temporal hairline, mark the endpoints of a curved line on which stomach 8 and gallbladder 4 to 7 are located at regular intervals by dividing the line into 5 parts. For needling, 0.5 to 1 kun transversely, subcutaneously, or obliquely in the direction of the disorder. Moxibustion possible, contraindicated according to some classical text. For actions or indications, eliminates wind from the head and eyes, benefits the eyes, alleviates the pains. With special features, meeting point with the yang wei mai and the gallbladder channel. Important local point for headaches and disorders of the eyes. Crossing point, stomach, gallbladder, and yang wei mai, the linking vessel. Consider when a patient is caught up in overprocessing, overthinking, mental turmoil, or where the head feels as though it is tied up in knots. From stomach 8, there is a deep pathway to due 24. Thank you for your attention.
Let's discuss liver patterns, liver blood deficiency. Concept: this is due to liver blood being unable to nourish the liver system. Clinical manifestation: there is dizziness, pale, lusterless complexion, withered and brittle nails, blurred vision or night blindness, numbness of the limbs, disturbance in joints movements, tremor of the limbs and muscular twitching, hypomenorrhagia, pale menstrual flow, amenorrhea with a pale tongue and ready pulse. Key symptoms: malnutrition of the sinews, eyes, nails, and general symptoms of blood deficiency pattern. For the analysis of liver blood deficiency pattern: failure to nourish the eyes, there is dizziness, blurred vision, night blindness. Failure to nourish the sinews, there is numbness of the limbs, contracture of the joints, tremor of the limbs, muscular twitching. Insufficiency of blood, hypomenorrhagia, pale menstrual flow, amenorrhea. Pale and lustless complexion, dizziness, pale tongue, ready pulse. Results to blood deficiency. Also, there is malnutrition of the sinews, eyes, and nails. For the summary, liver blood deficiency, etiology: diet poor in nourishment or lacking in protein, damage to yin blood as a result of prolonged illness, blood loss, excessive physical work, chronic illness, too much sexual activity. Underlying accompanying pathology: stagnation of liver qi, spleen qi deficiency, kidney yin deficiency, liver yin deficiency. Signs and symptoms: there is dizziness, numbness, tingling of limbs, insomnia, blurred vision, visual floaters, poor night vision, light menstruation, dull pale complexion, pale lips, muscular weakness, cramps, brittle nails, dry skin, hair, depression. Pulse is choppy or fine. For the tongue, pale body, paler sides, sides may be orangey. Treatment principle is to nourish yang, rectify blood. Puncture treatment, we use bladder 18, nourishes liver blood. Bladder 17 with moxa nourishes blood. Liver 14 calms the liver, disinhibits qi. Spleen 6 nourishes blood. Stomach 36 supplements blood. Bladder 23 enriches kidney to generate blood. Bladder 20 fortifies spleen to generate blood. Liver 8 supplements liver blood. Liver 3 forces liver qi. Ren 4 supplements blood. We use moxa. GB34 to nourish sinews. Extra point, Yuya benefits the eyes. Needle with supplementation. Relevant advice, it is important that a person who is liver blood deficient eats a diet that nourishes the blood. They will benefit from eating red meat, bone marrow, blood sausages. Eating organic liver will especially salutary because it nourishes both blood and the liver directly. Green leaf vegetables will also be beneficial because they have a high iron content and because their green color has a resonance with the liver. Other foods that nourishes blood are beetroot, seaweeds, dates, kidney beans, black beans, aduki beans, goji berries, angelica, and nettle tea. A person who is liver blood deficient should avoid sugar, stimulants such as coffee, and too much alcohol. The patient should eat a diet that not only directly nourishes liver blood, but also tonifies spleen qi, that is warm, prepared food that is not cold in its energy and does not produce dampness. Lying down from 20 minutes in the middle of the day is recommended as it enables blood to return to the liver. Excessive training should be discouraged. Thank you for your attention. Part 2. First, the onset of illness. This means the timing of the first symptoms, possible cause and exposure to inducing factors, as well as the mode of onset, that is sudden or gradual. Understanding these factors will help assess whether the illness is one of deficiency or strength, or cold or heat. For example, an illness that begins suddenly and lasts a short time is likely to be one of evil qi strength, whereas one that begins slowly and lasts a long time is likely to be one of deficiency. A cold illness usually follows exposure to exogenous cold, and a heat illness usually follows exposure to exogenous heat. Next, the characteristics of main symptoms. These include their location, nature, and duration. An understanding of these characteristics helps in the determination of the location and nature of the illness. For example, dull epigastric pain that is relieved by warmth and pressure suggests deficiency of spleen yang. Lumbar knee aches and weakness, cold intolerance, and cold extremity suggest deficiency of kidney yang. Next is concomitant symptoms. The characteristics of the other symptoms besides the main symptoms contributes to the differentiation of strength and deficiency and cold and heat nature of the illness. For example, suppose the main symptom is insomnia, if the patient concomitantly has palpitation of the heart, irritability, a red tongue with little coating, and a tread-like rapid pulse, the illness may be due to deficiency of heart yin. If instead the patient concomitantly is easily frightened, has a bitter taste in the mouth, a yellowish and greasy tongue coating, and a slippery and rapid pulse, the illness may be due to accumulation of phlegm in the bladder, in the gallbladder. Next, the course of illness. Knowledge of the course of the illness from its onset to its present state is essential to its correct diagnosis. It is necessary to ascertain whether the symptoms have worsened, lessened, or stayed the same, and whether the illness has taken an unfavorable or favorable turn. It is also important to know if the symptoms are intermittent spasmodic or steady, whether they have changed or remain the same, and if changed, when and why they change. Next, the previous diagnosis and treatment. It is important to know whether the patient has consulted another physician, what kind of examination he has undergone, how diagnosis had been made, and what medicine he has taken, and whether the medicine has been effective or not. Number 4, the past history. The patient's status prior to the development of the present illness, is clearly the result of many factors. Among the most important of these factors are his previous illness and his general health. For example, a patient who has always been in excellent health is more likely to develop an illness of strength. One who has been in ill health is more likely to develop an illness of deficiency, but is also more susceptible to exogenous illnesses. Number 5, personal lifestyle and preferences. The areas of interest here are the patient's lifestyle, diet, hobbies, pattern of work and rest, general state of mind, and addictions, if any. These all have the potential to affect his resistance or susceptibility to illness. In the matter of diet, an unbalanced preference for a certain state or certain taste may contribute to the vigor or weakness of some visceral organs. Improper work and rest patterns of habitat may also contribute to the development of illness. Number 6, family history. It is especially important where a contagious or hereditary illness may be involved. In addition to blood relatives, the family history should include all members living in the same household. In some cases, it is even necessary to know about persons in the immediate neighborhood. Thank you for your attention.
Let us now go to interview and history taking strategies. The topic is overcoming difficulties in provider-patient relationships. Some patient relationships will challenge the provider from their onset, such as initial encounters with patients who are angry or hostile. Even when a strong alliance has been established between the provider and the patient, critical events in the caregiving process and/or the influence of significant others may challenge the stability and effectiveness of the relationship. For example, Platt and Gordon refer to a phenomenon known as the two-patient syndrome, in which a family member or significant other serves as a translator for the patient. In such a situation, the answers to the provider's questions may reflect the translator's perceptions of the patient's healthcare needs, status, and goals rather than those of the patient, especially if the family member or significant other is also the primary caregiver for the patient. Similarly, adverse clinical phenomena such as unexpected fetal loss, chronic pain that is unresponsive to treatment, or the need to inform the patient and family of a terminal diagnosis will test the strength of the most well-established provider-patient relationship. In order to successfully navigate challenging situations, recognize the feelings and behaviors being manifested by the patient, such as sadness, fear, anxiety, anger, or hostility. Recognition requires that the provider be an attentive listener and observer, and that they take the time to reflect and process what they see and hear. Recognition often begins with a perception of distance or strained communication in a relationship that has previously been characterized by warmth and a free flow of communication. When this occurs, stop the usual routine of the visit and share these perceptions with the patient. Identify the perceived behavior or effect and seek the patient's confirmation as to the accuracy of these observations. If the nature and source of the patient's behavior are still unclear, reassure the patient that you have listened to him or her, but remain confused about why they feel the way they do. Ask the patient to help you better understand what they are experiencing. Do not become argumentative or defensive. Acknowledge and validate the patient's feelings as appropriate through the use of statements that convey understanding and concern, such as, "I can see where that would be frightening. Do you feel any better now?" Demonstrate empathy. Coulihan and Block define empathy as a type of understanding. It is not an emotional state of feeling sympathetic or sorry for someone. Being empathic means listening to the total communication with words, feelings, and gestures, and letting the patient know that you are really hearing what they are saying. For most, if not all challenges to provider-patient relationships, there is no quick fix, and attempts to implementing one are usually perceived by the patient as being dismissive of their feelings, thereby disrupting the relationship even more. Support and understanding are essential to building and maintaining a relationship. Touch may help convey understanding. If it is culturally appropriate and the situation warrants such an action, as in the loss of a loved one or when delivering an unfavorable prognosis, touch can be very therapeutic. Demonstrate hope. This is particularly important in situations involving poor prognoses. Although the eventual outcome may not be altered, the patient needs to know that the provider will not withdraw because cure is not an option. They will remain a consistent source of support and will help the patient to identify and achieve the life goals that are important in their remaining lifespan. Patients who are resistant to therapeutic recommendations represent another challenge to provider-patient relationships. Such resistance often represents a failure of the provider to fully engage the patient as a partner in decisions about their health care. Cultural norms and patient ambivalence may also be a major factor, as in patients who smoke. Smokers who have not experienced the negative health consequences of smoking often do not perceive themselves to be at risk, and their sociocultural environment may support continuation of this negative health behavior. The provider should continually assess the readiness of the patient to adopt or change the behavior or intervention and be ready to capitalize on any opportunity that may increase the patient's level of readiness. For example, a female smoker previously resistant to smoking cessation interventions may become very responsive if an abnormal pap smear causes her to be sent for colposcopic examination and she learns about the relationship between smoking and cervical cancer. The grandmother who smokes and cares for her grandchild while his parents work may be resistant to quitting for her own health, but may do so to protect the health of her grandson. Most practitioners are employed by healthcare institutions. Many institutional factors affect patient-provider relationships. Cost containment has led to an ever-increasing emphasis on productivity. Increasing patient volume often decreases the time allotted for initial and follow-up patient visits. If the time allocated for the patient sessions is inadequate to obtain all of the necessary historical data, the patient can be asked to complete a linguistically appropriate health history form before being seen by the provider. Prioritization of data collection is essential and is determined by the patient's expressed reason for seeking care as well as the presenting signs and symptoms. For example, although diet, exercise, and social history influence treatment decisions, the past medical history and a focused review of systems take precedence in the acute phase of illness. Thank you so much for your attention.
Let's go to 5-element constitutional acupuncture. Let's discuss overview of use of points. The overview of the use of points. Practitioners of 5-element constitutional acupuncture use points in different ways, 3 different ways. According to the type of point, these uses were first laid down in the early classics. For example, different types of points are backshoe points, yuan source points, element points, tonification points, etc. According to the qualities implied to the names by the names given to them in antiquity, for example, using points 5 spirit storehouse to treat a person at the level of the spirit. In some instances, the location of the point is considered. Third, using a combination of points. Some points are used together to create a specific effect. For example, using REN 15, stomach 25, stomach 32, and stomach 41 to clear possession or exit and entry points, such as liver 14 and lung 1 to clear a block. The use of points according to traditional usage. Command points. The Neijing and the Nanjing outline several different classification of points and give some indications as to how these points should be used. Much emphasis is placed on the use of command points, the points situated below the elbow and the knee. The 360 points of the whole body have their command in the 66 points of the feet and hands. In this quotation, the number 66 comprises the 5 shu points of the 12 channels and the yuan source points of the yang channels, which are shu points. The command points are considered to be especially effective at enhancing the qi of the organs. Giovanni Mascioscia describes them as being more dynamic than points on other parts of the body for 2 reasons. Firstly, because they are more superficial in nature, and secondly, because of the rapid changing and relatively volatile yin and yang dynamics present at the beginning and the end of the channel. These points are commonly used to direct, enrich, and command the qi. The element points, especially the tonification and sedation points, yuan source points, horary points, luo junction points, and qi cleft points. Other points with specific uses. Besides command points, there are a number of other points commonly used by 5-element constitutional acupuncturists. They are back shu points, exit and entry points, points on the Ren and Du channels. From Mu points, these points are palpated for diagnosis only. Although practitioners frequently use on various parts of the body, they tend to complement them with command points. This usually enhances their effect. If a significant change has been affected in the patient's color, sound, odor, emotion, or pulses by using only the body point, then it may be unnecessary to use a command point as well. Thank you for your attention. Let's now go to erectile dysfunction. Let's discuss channels influencing male genitalia. Channels influencing men's genitalia. The genitals are related primarily to the liver and kidney channels. The liver connecting channel loops around the genitalia. The genitals are also closely related to the directing, penetrating, and the governing vessels, Ren, Chong, and Dumai. While the influence of the directing vessel on the genitalia is obvious, that the governing vessel is often overlooked. As you can see in the figure, this is the anterior genital branch of the governing vessel. The simple questions describes an anterior branch of the governing vessel that flows to the external genitalia, both in men and women, and to the pubic bone, and from here ascends up the abdomen on the same trajectory as the directing vessel. It says, it starts in the lower abdomen, goes down to the pubic bone, in women to the vagina. Its connecting channel goes around the vagina, passes through the perineum, then the buttocks, down to meet the kidney and bladder channels inside the upper thighs. It then rises up the spine and wraps around the kidneys. In men, it goes around the penis and then the perineum. The main vessel starts in the lower abdomen, goes up to the umbilicus, past the heart, throat, chin, around the lips, and then reaches the eyes. Distal points affecting men's genitalia: so kidney 4, liver 1, liver 5, and Du 20. The pathways of the channels flowing through the genitalia are as follows. A branch of the governing vessel flows down to the genitalia. The directing vessel flows over the genitalia. The kidney main, connecting, and muscle channels flow through the genitalia. The liver main, connecting, divergent, and muscle channels wrap around the genitalia. You can see in the figure, These are the channels connecting the genitalia. Thank you for your attention.